PAH clearance for assessment of renal plasma flow. Para-aminohippuric acid clearance for measurement of renal plasma flow. Renal plasma flow can be measured by infusing p-aminohippuric acid PAH and determining its urine and plasma concentrations. PAH in low concentration is freely filtered and completely secreted in the PCT. Clearance of p-aminohippuric acid PAH measures the effective renal plasma flow ERPF, and not the actual renal plasma flow. This is because PAH has an extraction ratio. A small fraction of the RPF serves kidney tissue that is not involved in filtration and secretion of PAH, example renal capsule, adipose tissue. PAH will not be extracted from this portion of the RPF, and will be returned to the renal vein. Extraction ration equal to arterial concentration minus venous concentration by arterial concentration. For PAH, the extraction ratio is 0.9. An extraction ratio of 0.9 means that the kidney is able to excrete 90% of the PAH in a single circulation. In other words, 10% of renal artery blood goes to those areas which do not participate in filtration. Normal ERPF is 630 ml per minute. ERPF can be used to determine the actual renal plasma flow. Average PAH extraction ratio is 0.9. ERP by extraction equation is 630 by 0.9 is equal to actual RPF, which is equal to 700 ml per minute. From the renal plasma flow, the renal blood flow can be calculated by dividing by 1 minus the hematocrit. What happens if PAH is given at a high concentration? Clearance of PAH at low concentration gives the value of ERPF. This is because PAH at low concentration is freely filtered and completely secreted. As the plasma level of PAH increases, the filtered load of PAH also increases, filtered load equal to plasma concentration x GFR. Secretion of PAH increases with increase in plasma concentration of PAH, but only till it reaches the transport maxima. Secretion of PAH is carrier-mediated, and all carrier-mediated secretions have a transport maxima, or Tm. The Tm for PAH is 80 mg per minute. When PPAH is low, clearance of PAH is high, but as PPAH rises, its clearance decreases progressively. At high PPAH, clearance of PAH gives a falsely low value for ERPF. At progressively higher concentrations of PAH, clearance of PAH eventually approaches the clearance of inulin. This is because the amount of PAH secreted becomes a smaller and smaller fraction of the total amount excreted.